Welcome to the Health by Haven podcast. I'm your host, Haven Quinlan. If you're a multi-passionate wellness enthusiast, then you're in the right place. I'm obsessed with learning as much as I can about the wellness world, and I want to share that with you. Each episode will dive into various aspects of health and wellness through inspiring and informative guest interviews with some solo episodes thrown in. Tune in for all things health, and let's have some fun, shall we? Is your home in need of a refresh? I don't know about you, but I love reimagining and redesigning my space. If you're wanting to liven up your space and level up your decor, be sure to check out Arranger Paints on Etsy. The shop is full of beautiful paintings, many inspired by nature, and all sure to give your home a custom feel. The paintings also make great housewarming or birthday gifts. I've gifted paintings from the shop and have a Ranger Paints artwork in my loft. As a special thank you for supporting the Health by Haven podcast, you can get 10% off your order with code HXH10. You can find the full collection of work at arrangerpaints.etsy.com or scroll down to the show notes for the link. Hello again, wonderful Health by Haven podcast listeners. I hope your week is off to a great start. We are on a mini summer break over at Health by Haven and busy preparing for an exciting array of season 5 guests. So during this break, I'm re-airing some of my favorite conversations featuring health experts and inspiring guests. Today's conversation features Dr. Paige Butts, a pelvic floor physical therapist. She is such a gem and so much fun to follow along with on social media. Highly recommend following her. I love that her content brings humor into the PT and women's health space, especially when those topics can often feel super scary and overwhelming. And fun fact, Paige has some major life changes since we last spoke in early 2025. She's now pregnant and expecting another little one to add to her family. Let me quickly share some of Paige's credentials with you, and then she'll answer all of your pelvic health questions in today's conversation. Dr. Paige Butts is a wife and mom of 3 girls. She graduated from the University of South Carolina with her BS in exercise science and stayed at USC to obtain her doctorate in physical therapy degree. Paige has been practicing pelvic floor physical therapy for almost 10 years. During that time, she completed her fellowship in orthopedic manual therapy, became a certified lactation counselor, and became an integrative health practitioner. Paige has advanced training in pessary fitting for pelvic organ prolapse and stress urinary incontinence. She's also currently working on her perimenopause and menopause certification through IWHI. So many women Paige see daily are facing the struggles of perimenopause and menopause, and she loves educating and empowering them on ways to improve their quality of life. She has a passion for helping with chronic pelvic pain and dyspareunia, and she loves treating women in the peripartum and postpartum period, teaching moms how to best serve their bodies during pregnancy and beyond. I know you're going to love this interview with Paige. I learned so much chatting with her. I hope you do as well. Thanks for listening. Thank you so much, Paige, for joining us on the Health by Haven podcast today. How's your week going?
It is going good. We started off Monday strong. St. Patrick's Day, the leprechaun has to come visit my house.
Oh, so fun.
So my kids set up a leprechaun trap yesterday.
No way. Tell us more.
Expectation has been set high. The leprechaun has to come. I sent my husband to the store to get a leprechaun yesterday to catch in the leprechaun trap.
Oh,
he
good.
came home with a leprechaun nutcracker. He said that was the only leprechaun he could find. And I go, so how much did we spend on this leprechaun nutcracker? It was $15. And I was like, can we take it back?
Yeah. Or you can make
no return.
Make a reappearance at Christmas as well.
Like, we're going to save this for every year to come.
Amazing. Oh my gosh. Wait, do you have other fun St. Patrick's Day traditions?
No, this started last year.
Okay.
My oldest, being the type A that she is, had to have a leprechaun trap, and she needed the food, the crafts, and I'm not a crafty mom. I don't crafts are not my forte. Anything outside of coloring and coloring books and a little Play-Doh, I probably don't really want to do. So I sent them outside and I was like, take all the crafts you need outside, do what you need to do. And she had everybody, I have 3 kids, so she gave everybody a task.
Oh, yeah.
And they pulled
Sounds
it
like the
together.
oldest daughter.
Yeah, everybody had their task. They got it done. And hey, here we are.
Well, she's a more
Leprechaun's gonna
efficient,
come visit.
a more efficient, or I guess effective oldest daughter than I was. You know, I had 2 younger brothers and bossed them around as well as a kid, but they didn't always finish their assignments. So
I know. I feel like I'm the oldest too. I have a younger brother. I don't know that I'm as, I mean, I guess in some aspects of life I'm type A, but not particularly. She
yeah,
definitely is more type A than I am.
yeah. Well, there's pros and cons.
I think when it comes to business stuff, I'm very type A. In my personal
Mm,
life, I'm very not type A and
yeah.
usually just not on top of it.
Yeah. Well, hey, you get done what you need to get done, right? So
We
it's
try,
fine.
doing the best we can.
Okay. Well, I'm just so thrilled to chat with you today. I had a good handful of women's health episodes recently, which is such an important topic. So I'm so
Love it.
excited to chat
Love
with
it.
you and had a mutual friend connect us. And so I know we're going to have a great conversation today. But for people who are listening, who are like, what in the world is a pelvic floor PT, or what do they do day to day? Can you
Yes.
fill everyone in?
I sure can. It's the best ever, best part of PT. So I treat the pelvic floor is literally a bowl of muscles that live inside the pelvis, and they're primarily responsible for supporting internal organs. So for females, bladder, uterus, and rectum. For men, the bladder and the rectum. They are there to stabilize the hip and the back. They work on making sure that we can pee and poop when we need to, and that we don't do those things when we don't need to, and being able to appropriately allow for sexual intercourse, penetrative intercourse, whatever that may look like, being able to relax and contract for that to happen. And also during pregnancy, providing the support and the stabilization through pregnancy and allowing for delivery, whether it's vaginal or cesarean. So that is the lovely pelvic floor.
Yeah, well, that's a great fill-in. And I know like lots of different like Pilates type exercises. I feel like
Mm-hmm.
you really try to engage those muscle groups. Like I teach Pure Bar, and so I feel like a lot of times we're like strengthening through the core and things like that. And so I guess just jumping right in, like what
Yeah.
are some exercises that you see like really beneficial for that versus some that maybe not as much?
Yeah. So it kind of depends on what, like if I'm seeing somebody from like a therapeutic standpoint, so that typically means that there's something going on with their pelvic floor that is causing issues, whether that's urinary leakage or any kind of pelvic pain, issues with bowel movements, that kind of stuff. So it kind of depends on what someone has going on as to what I think is the most beneficial. I think across the board, like Pilates, yoga, Legree style, like those kind of things have become very vital, whether it's a pelvic floor weakness or a pelvic floor tension issue, as we work through breathing. And I think all of those things kind of talk people through breathing really well, which is very important for the pelvic floor. So as long as they're being coached through the right breathing techniques, that is all really beneficial. Now, in terms of like a tightness tension aspect, I'm never going to say that any kind of exercise is bad for somebody or that you shouldn't do it. There's just different things that I'm going to ask that people do in terms of pelvic floor relaxation. So if somebody tends on the like tighter, tenser end of things, which in reality is most of who I see, about probably 97% of my caseload is a tightness tension issue.
Mm.
There's just certain things that I'm going to have them work on before a workout or after a workout to help on releasing the tension through the pelvic floor. Does that make sense?
Yes, absolutely. And this might be a bad question for a podcast. It's not visual, but like, what are some of those things that you have them do? Since you said like 97% of your clients
Yeah,
are
yeah,
tending
yeah,
towards that, what are some things, maybe if someone's listening and they're like, oh, wait,
yeah,
maybe that's me. What are some of
yeah.
those exercises?
Yeah, so I like for people to have a good range of mobility type work. So hip, low back mobility. So anything that's kind of stretching or working through like the inner thighs, the glutes, the hips, and really spending time with that, not just like I'm the worst in terms of like, I want to just like kind of get that stuff over as fast as I
Yeah.
can. But that's really where we need to be spending our time. So really just focusing in and honing in on that, whether it's before a workout or after a workout, making sure that we're really opening up the hips, opening up the glutes, the inner thighs, and whatever kind of sequence that looks like. I usually have people shoot for like 4-ish different stretches or mobility type work. I never want people to feel overwhelmed because I find that if you can meet them where they're at, giving them the right amount, the right dose, they're actually super beneficial. If you give them too much, then they choose not to do anything. So you kind of have to work with who you're working with to decide, do you need 2 things or do you need 5 things? I always kind of stack on. So each time I see somebody, I'll kind of add stuff to their program. And I'm always like, it's not for you to feel like you have to do everything I'm giving you, but so that you have tools in your toolbox and you have different things that you can choose from. Then I have my people that want to do everything. And then I have the ones that are like, nope, I've got the 3 I like, and that's the 3 I want to do.
Yeah.
But really, and diaphragmatic breathing is a really big one because that helps work pelvic floor through full range of motion. So the diaphragm and the pelvic floor muscles have a direct relationship. As you inhale, the pelvic floor will actually relax to allow for receiving of the pressure with the breath. As you exhale, the pelvic floor will actually contract at the top end of range to kind of push the breath out or to push that pressure out. So I really like to have people work on diaphragmatic breathing. Typically, that's more something that I'll have them do like at night before bed, not necessarily like when you finish a workout, I want you to carve out this time right here in front of everyone and work on some diaphragmatic breathing. But that's another really good one that helps work that pelvic floor through range of motion.
Okay, cool. That's great to know. And I know I just literally dove straight in,
No, give it to me.
but I feel like I don't know if it's just in my life. Like I never knew pelvic floor PTs existed until like a few years ago. And now I feel like I'm hearing about it more and more, but I'm curious like how you even learned this was an area of physical therapy to go into and how you became interested in it.
So it's really funny because growing up, I always wanted to be an OBGYN. And then my freshman year of undergrad, I actually worked in a health services clinic that specialized in diabetes education, PT, and cardiac rehab. And so I worked in all 3 throughout that year. And that was when I was introduced to physical therapy. And I was like, this is actually what I think I want to do. And so I kind of pivoted into that range. And I actually did my undergrad research in geriatrics, like falls gait mobility training. So I wanted to go to PT school to be a geriatric PT.
Oh.
And my first semester of PT school, I learned about pelvic floor PT. And I was like, wait a second, never heard of this. Didn't know it was in our scope of practice. And I was like, this is what I have to do. And so I went to our professor that at the time that placed us on clinical rotations. And I was like, this is what I want to do. Like, help me figure out how to set myself up to be able to do this when I finish school. And he was like, I knew you were going to be the one that came to me and said you were going to want to do this. And I'm like, well, here I am. So then from that, I just kind of had to figure out the path of, because you don't get it in school. I mean, we have like, I used to do like the guest lectures for the PT program. Like you get like lectures, but you don't ever get like formal pelvic floor PT training. So we have to do a lot of like con ed. And then I did my last clinical rotation in pelvic floor. So then I got to do 12 weeks of training with a mentor, which worked out really, really well.
Okay, cool.
I just haven't gone back since then.
Yeah. And so are most pelvic floor PTs working like in a hospital, in a clinic, out of their own practice?
I'd say you kind of get a range. I feel like more are either working like in a clinic or in their own practice. I think having one in the hospital is ideal. I just don't feel like we're there, and it's because limitations on coding and billing and stuff. So there are PTs that work in the hospital that will go to like the mother baby unit and see moms if it's requested, but it's not like a formal practice, at least in the hospitals around here, which I think would be really great. But
yeah,
we're not
of
quite
course,
there.
of course, because maybe one day soon,
One
hopefully.
day.
Yeah, because I know that like a lot of the times that I've heard about pelvic floor PTs have been around like friends who have had babies and then they're wanting to like go and help strengthen their pelvic floor again after giving birth or things like that. So is that the
Yeah.
majority of your clientele? Maybe talk us through like who you typically work with.
Yeah, gosh. So I really see such a wide range. I have a couple high schoolers that I'm seeing right now, and it's usually for things like they can't use a tampon and they feel like they should be able to insert a tampon. And they know at some point they're going to want to be able to have sex along the way. And they're like, if I can't even get a tampon in, how am I ever going to be able to do that? Which I just think is great that even at high school age that you're open and willing to like talk to your doctor about it to find out that that's not normal, or it's either your doctor that you've talked to or your friends and you're like, all of my friends can use a tampon and for some reason I can't. I just feel like that's not right. So I see high schoolers. I would say like the large chunk of who I see is postpartum in some degree, whether it's 2 months postpartum or it's a couple years postpartum. Because I think your postpartum after you've had a kid doesn't matter how long it's been. But I would say, the majority is postpartum, but there are the ones that I have that have never had kids that also have pelvic floor dysfunction as well. So my biggest thing is, and I've had ladies that I've seen in the past tell me that they have urinary leakage and they go to the doctor and the doctor's like, well, you haven't had any kids, so you can't be having urinary leakage. Well, actually, yeah, you can. You don't have to have had a kid to have pelvic floor dysfunction, whether that looks like leakage or pain or whatever that looks like. It's not, your pelvic floor doesn't wait for you to have a baby to say that it's not going to do something the right way.
Yeah.
So, I kind of see it across the board. I'd say the majority is probably postpartum though.
Okay. Well,
Yeah.
I'm so glad you said that because I feel like the more and more people hear like, oh, this is a thing and this is a doctor that I can go see to like work on these things that less people will be having, like the pain or the problems that could come with pelvic floor dysfunctions. Let's pause for a moment, especially if you're in the postpartum season or getting ready for it. After birth, so much of the focus shifts to the baby, and it can be easy for your own care to fall to the bottom of the list. That's why I love the postpartum support package from Avoda Massage Therapy. It's built around the idea that you deserve support too. This package includes 2 75-minute in-home visits so you don't have to pack up yourself or your newborn to get care. You'll also receive 2 postpartum massage sessions designed to help your body rest, recover, and gently release tension from pregnancy and birth. Avoda also includes a castor oil pack and a reusable heated water bottle, so you have simple, supportive tools to use between sessions when your body needs a little extra warmth and care. The full package is available for $680, offering consistent, thoughtful support during a really tender time. If that kind of postpartum care sounds like something you'd appreciate, you can learn more about the postpartum support package at avodamassagetherapy.com. Maybe if somebody is like, oh, wait, maybe I need to go see a pelvic floor PT, like what would some of those cues be? Like, who would you recommend? Like, oh, you should come in and see someone like me.
Yeah. That's a good question. So, a lot of times it's going to present as something like the tampon situation. So not being able to insert a tampon, wanting to be able to have intercourse and not being able to achieve successfully, having any kind of urinary leakage, whether that's something like coughing, laughing, sneezing, going for a run, exercising, or if it's like, I feel like I need to go to the bathroom. And as soon as I get that urge to pee, I can't make it to the bathroom without leaking on the way. A lot of it is, I see a lot of pelvic pain, whether that is just like day-to-day pain or with certain activities, chronic like constipation, bowel movement issues. And then anybody that has a diagnosis of like endometriosis or interstitial cystitis, PCOS, those kind of things, that all kind of tends to lead back into pelvic floor. Not that pelvic floor is going to make those things go away, but pelvic floor tends to come in as a compensatory pattern. It likes to kind of tighten and tense up anytime that something is going on. So by treating the pelvic floor, we can help manage symptoms a lot better. So urinary leakage, bowel movement issues, any kind of pelvic pain, if you're having low back pain or hip pain associated with like your menstrual cycle, exercise, a lot of times what I see too is people will see like an ortho PT for their back pain or their hip pain. And the PT's like, I feel like I can get them like 85% better, but we've just kind of hit a plateau and we haven't really been able to get over that last little bit. Usually there's a pelvic floor component.
Okay.
And I think the stats like 95% of women with low back pain have pelvic floor dysfunction. So pretty much if you have low back pain, you probably also have pelvic floor dysfunction.
Well, I mean, that's right there is like something so great to know because I feel like lots of people are dealing with that. And so maybe that is like, this is a cue that's like, oh my gosh, wait, maybe this is how I can fix that low back pain.
And a lot of people that I see too who have done like conventional, what I would say like ortho PT, and they're like, I still have the lingering back pain or the hip pain. And it's just because of where the pelvic floor muscles attach. They literally attach to the tailbone, the sacrum, and the inside part of the hip, which ortho PT is great. And for the most part, like can give you the relief and the management that you need. But if there's something going on with those muscles specific, you're not going to quite get to it unless you see a pelvic floor PT. So I always tell people like anytime there's things lingering, like we should be able to get to the end of it. Like why are you still having the back pain, even after you've seen whatever kind of treatment plan you've had? Really, you should be able to get rid of the last little bit to a degree.
Okay. So I'm wondering like people who are listening, if they're like having some of these problems and like some of it feels probably like really personal or like really uncomfortable to talk to your doctor about or talk to somebody about, especially if you maybe don't have like a super close relationship with them. You just go like every once in a blue moon if you're like having a problem or something. So maybe like walk people through. If they're listening, you pretend we're like a new client or like new patient with you. Like walk us through like what does that like first visit look like? And then after that, how you work with people.
Yeah. So usually the first visit, what I tell people, like if I talk to them on the phone or like through email or text message, I really try to make it because I know, I mean, like for me, this is what I do every single day. So I'm not a super modest person, but this is like a very private, personal situation for most people. And so I always tell them we kind of just take it in whatever direction we need to. And I just work with you and like what makes you comfortable. Typically the first session that's the evaluation. So that's where we're going to sit down and we're going to talk about your whole history. And I get to see people for an hour, which I think is just so great because there's a lot that goes into pelvic floor dysfunction in any capacity. And I think just being able to have the time to be able to sit down, let you tell me your story, let me ask you questions along the way. And that way we get like a good idea of what is really going on without feeling like we're rush. So we get to actually sit down and talk about it. And then usually that first assessment is going to be a lot of external, but also internal work. So the internal component is what I tell people. Usually it's just a vaginal or a rectal examination based on whatever the person's presenting with. However, we need to assess the pelvic floor muscles the best. And that's usually like most people are open to that. Most people by the time they get to me are like, yeah, I mean, like how else are you going to figure out what's going on with the muscles there, right? But I always start externally first just so they get a feel for me. They get comfortable with me. I kind of make the environment as comfortable as I can because I know, especially the first visit, like you have no idea who I am. And like depending on how much coffee I've had, you know, we either start right out the gate or we just kind of ease in. I really try to just make it as comfortable as I can for people. But the first visit, that's usually what that looks like. And then subsequent visits based on whatever we found on the initial evaluation will kind of dictate what your treatment plan will look like. Most visits, not every visit, but most visits do involve some form of internal pelvic floor release paired with like soft tissue massage, cupping. I do a lot of dry needling and exercise based. So that way we kind of work on releasing the tension through the pelvic floor, but then also retraining those muscles to work within that new range so that you ultimately don't need pelvic floor PT anymore. But I tell people these muscles are just like any other muscle in your body. They're just internal. So it's just like you get like stressed out and you get the knots in your shoulders. Well, the same thing happens in your pelvic floor. Those muscles get really tight. They get really tense. They get trigger points. So we work on releasing those trigger points and the tightness, but then we have to train those muscles how to now work because they've got a new range that they're not used to working in. Does that make sense?
Yeah,
It's not
absolutely.
a word vomit.
No, that's super helpful. That's super helpful for people to know who maybe have never seen a pelvic floor PT to know kind of what to expect. So, of course, like there's benefit to going and getting the physical therapy and all of those different modalities. And then you said your goal is for them not to need to go to a PT forever and ever. So I know you mentioned you have like around 5 exercises you like to give people, and it's we can't like visually show people on the podcast, but like what are some exercises people could be doing like at home in their day-to-day besides the diaphragmatic breathing to like help maybe if they're feeling like they're having tension?
Yeah. So with the tension, that's going to be more of like your mobility stuff. So I'll tell people too, like if they find a lot of people like have like a yoga YouTube video, like a 10-minute yoga or a 10-minute, just kind of like a relaxation or a, what's the word I'm looking for? Mindfulness. So the Calm app is one that I like to tell people to use, and you can pick your time limits. So if you just want to be able to do 10 minutes of mindfulness, honestly, anytime somebody is having any kind of pelvic floor tension, relaxation is key. It's not necessarily that I need you to go home and crank out lunges and squats and deadlifts. We need to be able to do those things and be able to do those things functionally without pain. But in those first couple of visits where we're trying to down train the muscle system and the nervous system, I'm going to have you be doing stuff that's more relaxation based. So the Calm app is a good place to start. Honestly, any kind of stretching is going to be fine. It's just a matter of making yourself do it and holding the stretches where it's not just like how fast can we get out of here, you know?
Yeah.
But that's usually those first couple visits. Now, ultimately we need to be able to do the strength training and the functional movements and movement patterns without increasing pain or without increasing symptoms. But you have to work on relaxation first. Then you retrain the body how to do all of those things without increasing your symptoms.
Okay. Awesome. And then I know that you said like 97% of the clients you're seeing are like tension based. So the other percentage, like what are some of the symptoms that they're presenting?
Yeah. I mean, honestly, it's probably like 100%, but I didn't want to be dramatic. I literally probably don't have anybody that's on the weakness side of things.
Yeah.
So most people that I see, it's more tension and tightness, not necessarily weakness. Even my ladies that come in that have just had a baby and they're like, my pelvic floor is super weak. I need to work on strengthening my pelvic floor. And I think it's just something that as society has made us believe that you have a baby and your pelvic floor gets weak and that you have urinary leakage, your pelvic floor must be weak. It's not typically a weakness issue. It's more of either a tightness, tension, incoordination issue or just an incoordination issue. It's been, I mean, I have maybe one right now that is strictly weakness, but it's also incoordination. But very rarely do I ever get just a weakness, like your pelvic floor is just so weak, it's not doing what we want it to do. It's usually got a tension component to it. But I think the biggest thing is that people think like urinary leakage is just the big thing that sticks out to me, that everybody who comes in thinks that because they're having bladder leakage that their pelvic floor muscles are weak. And oftentimes it's just not the case. We just have to retrain the muscles and the abdominal muscles and the diaphragm and the breathing coordination under load to reduce the leakage. It's not necessarily that your pelvic floor muscles aren't doing their job. It's just they kind of forgot how to do their job.
Okay. Makes sense.
If you're a parent, you know how intense the school year can be for kids. Academics, activities, social stress, and just the pace of life. What a lot of families don't realize is that kids often carry that stress in their nervous system long after the school year ends. This one's a little personal for me. I've known Dr. Brittany since we were teenagers on dance team together, and seeing her now support families in this way is really special. At Foundation of Stone Pediatric and Perinatal Family Chiropractic in Knoxville, Tennessee, they focus on helping kids regulate, recover, and build resilience through gentle nervous system-based chiropractic care. Summer is one of the best times to start because kids aren't as overwhelmed with schedules and there's space to focus on their development. You can learn more at tnkidschiro.com, supporting healthy kids from the inside out.
Going back to the schooling piece, because I know you said you didn't get a lot of the specifics in school. It's a lot of like continuing education. And I know that you've gotten lots of different certifications. And so if we have people listening who, like, maybe we have some high schoolers or college students listening who like are thinking they might want to study this and do this for a living, like what are some of those different continuing ed and certifications and things that you've done, and like what have they covered?
Yeah, so I think the biggest thing, and I think something that worked particularly to my benefit, is that I figured out when I was in PT school that this was going to be kind of the direction that I wanted to go. So that way I could structure my clinical rotation so that I could actually get the training and the mentorship. So I took a level 1 course before I did my clinical rotation. And that way I just had like background knowledge. It's hard. And I think you could say this with any kind of continuing education course, no matter what you do or who you are. You go and you get the education and you get the information, but then you have to know how to implement it.
Yeah.
Which can be the tricky part, especially for something where it's internal. You visually can't see it. You just have to know kind of where you're at and how to take that information and make a treatment plan for somebody. So I think if, that worked out for me in terms of like, I knew that's what I wanted to do. I was able to get 12 weeks of hands-on mentorship and training, and I still am in constant contact with my mentor as well. But any kind of like pelvic floor, you've got stuff through like APTA, through Herman Wallace. That's like kind of where I started with like my basic con ed. But then you kind of find like your niches and where you want to branch out. Like right now, like I love the perimenopause, postmenopause group, and I love pregnancy and postpartum. I just hold that dear to my heart. I've had 3 kids. I just know that those times are so trying and you feel like you're in the trenches for a lot of it. But you come out on the other side and it's the best ever. But you kind of figure out where there's so much within the scope of pelvic floor that you can kind of hone in on and specialize in. So it's really about figuring out what brings you the most joy. I love chronic pelvic pain. I've always had such a spot in my heart for dyspareunia or pain with intercourse, because it's such I got into a battle with insurance at one point because I was trying to see a girl who couldn't have sex, and they told me that wasn't an activity of daily living, and so they wouldn't cover it. And I was like, well, do you not consider that an activity of daily living? Who are you to tell me that
right.
That doesn't something that someone should be able to do? Anyways, I digress. I just think that being able to see somebody go from like not being able to consummate their marriage or be able to have sexual interactions with their partner, I think being able to see them go from that. And when you get these people, like, it's tough and it's hard. It's hard on them. It's hard on their relationship. And I always encourage them, bring your spouse, bring your partner, bring whoever it is with you so that I can educate them also on what is going on, because it becomes such a mind game because you can't see it. Only the person can feel it.
Yeah.
And so I just think being able to see somebody go through that span of treatment is it's the best.
Yeah. Well, you're clearly helping like so many people in so many different phases of life, and you're so passionate about it, which I love. I love talking to people who are like, who are like so into their field and like really want to help make a difference in people's lives. So that's so amazing. And so I'm curious, like, what are maybe a few common misconceptions or like one main one you feel like about like pelvic floor that you want to debunk? Because this is your open mic, like let it rip, girl.
I would say, I think, which you would probably see a lot on social media, is the whole like Kegel situation. So I think a lot of people, you've heard of Kegels?
Mm-hmm.
Okay. So a lot of people, and again, like, I don't think it's the fault of anyone. I think it's just society and what we have come to think of pelvic floor is you need to do your Kegels. You need to do your Kegels to get ready to have a baby. You need to do your Kegels if you're having leakage. You need to do your Kegels because nobody really knows what's going on with the pelvic floor. And Kegels are just not, I'm not saying they're the worst thing ever. I mean, Kegel in the definition is a contraction of the pelvic floor muscles. What we as a society have turned it into is a squeeze and hold of the pelvic floor muscles to work on strengthening. But I just don't think that you can blanket statement that if you've never assessed someone's pelvic floor.
Yeah.
How can I tell you to sit there and squeeze your pelvic floor muscles for 10 seconds, hold it, then relax for 10 seconds, then squeeze and hold for 10, and I want you to do that 50 times? Well, I don't know what your pelvic floor is doing. Do you even know how to squeeze your pelvic floor? Is your pelvic floor too tight and too tense and you're having pain, which is why you're having pain because it's too tight and tense? Now I'm telling you to do Kegels and squeeze and hold. You know what I mean? Like, it's just, it's not a one size fits all. And I always tell people, a lot of the providers here I've worked with for a long time, and now they kind of know my stance on Kegels. I would almost rather you not tell someone, I would rather you tell someone to do nothing than to tell them to do Kegels. Because more times than not, by the time they get to me, if they've been doing Kegels, I'm going to tell them, well, you don't need to be doing those. We're going to stop doing that because it's actually making your muscles more tight or more tense. And so we're going to reverse that for a little while. I don't hate it when the muscles can work through full range of motion. Fine. It's not a super functional activity. I mean, you're not going to walk around Kegling all day. Your muscles need to know how to contract under certain load and at the right time, which is what we work on, is just timing, coordination, endurance. But you don't need to just walk around Kegling your muscles all day. So, you know, Kegels get a bad rap. There's a time and a place, maybe, but I think that just kind of blanket statement telling people to do this anytime there's something going on with their pelvic floor, maybe like one in, I'm going to be dramatic because I don't love Kegels, like 1 in 50, you might help. But, you know, I mean, it's not, there's just, the pelvic floor does more than Kegel.
Yeah. Yeah. Well, I think that's great for people to know, because you're right, like buzzwords, and then people who don't really maybe know what they're talking about or know someone's individual situation, it can be a challenge.
Yeah. Yeah. So that's kind of my little soapbox on Kegels.
Yeah. Yeah. We're here for the soapboxes.
I can really get going.
Yeah. Yeah. Okay. So if someone is going to their doctor and they are like, I think I need to go see a pelvic floor PT, like, how would you recommend them going about finding somebody who like they fit with, that would be best for their situation? Yeah. Give us some advice.
So I think depending on who your provider is, if you have a really good relationship with your provider and they have somebody that they recommend, that's usually like a good place to start. But also in the era of social media, you get to see a lot and you get to know people through social media, which is really funny because I have no idea what I'm doing on social media. And I had people that call me and they're like, I found you on Instagram. And I'm like, oh my God, and you still called me. So that you want to come see me. But I think social media just kind of opens up a world to where you feel like you get to know people without actually knowing them.
Yeah.
And I think you get a vibe for who somebody is over social media, kind of what their treatment style is, what their space is like. I mean, even knowing where you're going before you get there, right? Like it just helps make things a little bit less stressful. So I think social media honestly is also super helpful in terms of like, if you know your area and you can search pelvic floor PTs in your area, and then you go to social media and you can find them and you can say like, oh, she looks crazy, I might not like her. Or like, oh my gosh, like I actually really resonate with her. And I think that would be a good fit for me.
Yeah.
There's also a place that you can go. Oh, geez. I knew I wasn't going to remember the name of it. It's through it's a pelvic floor search group. It's through like Pelvic Floor PT Rising, I think is what it's through. But you can go on there, you can put in your like zip code, what kind of radius you're looking at, and it'll populate all of us that are like registered through the system. So that also works really well. And usually it'll take you to like their social media or their website, and it'll give you all their information, which is a really good place to start too.
Okay, cool. And then as far as like finding someone with your insurance, like what does that look like? Because I know physical therapy usually is like so different than like your regular like primary care doctor.
Yeah. So it kind of depends on where you're looking at. So I'm actually out of network with insurance, and you're seeing that a lot more in the pelvic health PT world is a lot of us are kind of starting to navigate outside of the insurance realm because of the stipulations and the restrictions that billing, coding, and insurance have placed on us. And so a lot of us are out of network now. But there are still a ton of people that are in network too. So it just kind of depends on where you want to be and who you want to see as to what that would look like. Out of network people, I'm not going to say all of us because I don't know what other people are doing. Most of us still provide you with a certain kind of billing document that you can get reimbursement through. But we kind of have a lot more flexibility in terms of how long we can see you. How many visits, what do we want to work on? Because a lot of people, I start seeing them for their pelvic floor, but when you start really like assessing an individual, I mean, I could be treating your TMJ and your neck, but I'm treating it for your pelvic floor, or I'm treating your foot and your ankle for your pelvic floor. And in the traditional like insurance-based model, you can't necessarily do that because insurance will only cover one body part at a time.
Yeah.
So like if I'm treating your ankle, well, that doesn't work because you're supposed to be treating her pelvic floor, So it's I forgot your original question, but that's another soapbox of mine is insurance versus
yeah. No. You answered it, and like you're getting me on something that like makes me crazy is like everything is interconnected in health, and like so much of the health world is like separating every little thing and not realizing like stuff has a like domino effect. So now I'm so curious, like when you're treating someone for their jaw or for their ankle, like tell us more. How is this all interconnected?
Yeah. So if from like a foot and ankle perspective, if you think about how you transfer force with walking or running or doing anything of the sorts, it all starts at the foot, right? So if your foot and your ankle don't have the mobility, the flexibility, or the strength that it needs, you're going to be having compensatory patterns that travel up to the hips, which is where your pelvic floor muscle is attached to. And the jaw has a direct connection to the pelvic floor. They've actually run studies where they've hooked up like EMG sensors to the jaw and to the pelvic floor. And as you start to contract one, the other one also contracts.
Oh, wow.
And it's through like fascial patterns. It comes from like an embryological standpoint. But we know that people that have TMJ typically also have tension and tightness in their pelvic floor.
Wow. That's so crazy.
That's crazy.
That's all
literally like head to freaking toe.
Yeah. Wow. You're teaching us so much right now. At least me. I'm like, wow, this is blowing my mind.
A lot of times, like I'll get people in their like initial intake and I'm like, okay, do you have any like jaw pain, TMJ issues? And they're like, oh my gosh, yes. Like, I wake up in the mornings and my jaw is just so tight. And I'm like, okay, well, we'll work on that too.
Oh my gosh. Wow. You're really enlightening me right now. This is wild. Okay, I feel like I could literally talk to you all day. I know you have a patient coming up and I want to be respectful of your time. And so I'm going to switch us into some fun final questions. But before I do, is there anything else that you're like, I have to make sure people know this?
I think even if you don't think that you have pelvic floor dysfunction, you should still go see a pelvic floor PT because I think that we have so much education to give to people. And a lot of women don't really understand the full extent of their pelvic floor and the functions and what their role is. And that's really what I find most people say after their first day with me is like, I cannot believe that I'm 55 years old and I have never seen a model of my pelvic floor and I've never been told exactly what it does. And everything that I thought was normal isn't normal. And so I think just even like, I call it a wellness check, like just call up your local pelvic floor PT and just tell them that you want to come in and just have an evaluation. And that way, you know, baseline, like, do I have pelvic floor dysfunction or do I not? Sometimes people come in for a wellness check and they think nothing's wrong. I have one girl in particular, and she was like, here I am thinking my pelvic floor was fine. And I came to see you and I had no idea that my pelvic floor was so tight and all of the things that she was experiencing weren't normal because you don't know what's normal if you've never experienced anything other than what you have going on. You know what I mean? So you don't know what you don't know. And something that you think is normal. I have somebody that poops once a week. She has pooped once a week since as far back as she can remember. She literally thought that pooping once a week was normal. And she was like, wait, what? You mean you poop every day? And I'm like, yeah, girl.
Yeah.
And so she told me the next day she saw me, she's like, I went home and I told my parents that I've only been pooping once a week and they were mortified. But like, girl, they're not keeping up with your bowel habits, right?
Yeah.
So I think it's important just to have a baseline, like know what's going on with your body, know what it's supposed to do, what is normal, what's not normal. A lot of things are common, but that doesn't mean it's normal. So I think if anything, just like go and just like get a good pelvic floor wellness check.
Great advice.
It'll serve you good.
Great advice. Okay, switching us over into some fun final questions.
Yeah.
What's your favorite workout?
Oh, okay. So I have a lot. Well, okay, I love my Peloton. So I'm a big runner. I really enjoy running, and I got injured back in PT school, and so I had to stop running for a while, and I picked up cycling, and that was kind of where my like love of cycling came in. Now my favorite workout is like a 75-degree long run where I can just like turn on my music by myself without my stroller and just go for a run and come back when I'm ready.
Yes.
But I love my Peloton. I love cycling. It just kind of it pushes my limits. I have to turn the leaderboard off. I'm not competitive with other people. I'm only competitive with myself and my PR. But then I was like getting off the bike and I was like getting like dizzy and stuff. And my husband was like, you need to put this away. And I'm like, no, it's just me. I just need to put the leaderboard away.
Yeah.
So if I push the leaderboard out of the way, I'm fine.
Oh man. See, we could have spent a whole hour talking about running and everything.
I know. Because you're a big runner too. I love it so much.
Yeah.
The weather, you're not in South Carolina, but the weather that we had this weekend, Saturday, was just a perfect run day. And I took the kids out. So I have a triple stroller.
Oh my gosh.
Don't even get me started on it. I swear my neighbors think I'm insane. And maybe I don't know. But they've grown up in the stroller and they do so well. They love it. They like bring their toys and their snacks and they just like play games.
Yeah.
And I just turn my music on and we just push through the neighborhood. It's real, like that's my happy place.
Oh, I love that. And it's good family fun too.
I know. And then when you put the stroller away, if I'd run without the stroller, I'm so fast.
Yeah. You're like, wow, this is amazing.
It's amazing what running without a stroller will do for you.
Yeah. Wow. It's great resistance training.
And it has a 0 self-propel feature. So it is like a straight, like you got to push the stroller.
Wow.
Push it.
Wow.
Push it. Mm-hmm.
Amazing. Here I am feeling good about my solo run, but
I mean, man,
that is a whole nother level. Yeah. Okay. What is your favorite food? Or you can pick a few because I feel like that's a hard one.
My favorite food is sloppy joes. I grew up on the manwich sloppy joe. And my husband he says he's not picky. Yeah, he is. So he has figured out how to make homemade sloppy joes that I'm telling you, they're better than manwich.
Wow.
I didn't think you could get better than manwich. But yes, so sloppy joes are my favorite. And actually one of my kids asked me that the other night at dinner because I also like salmon with a specific like dry rub. Again, my husband does most of the cooking. And so he has some kind of dry rub that he puts on the salmon. And that is close second.
All right.
And so one of my daughters was asking me, like, what's your favorite dinner? It's funny that you asked me that because she literally asked me that last night. And then my oldest being she knows everything. She was like, I know what it is. It's sloppy joes. And I'm like, you're right. It is sloppy joes.
That is so funny. We were on the same wavelength.
Oh, I love a good sloppy joe. You got to put the pickles on it.
Also, you and my mom would like to share some meals because those are probably 2 of her favorites as well. So.
Oh my gosh. I don't know what's in this dry rub for salmon.
Yeah.
Text me later and I'll get it for you because you need to give it to her. You put it in the air fryer.
Oh yeah. She would love that.
Delicious.
Okay. I've got some rapid fire this or that for you.
Okay.
Morning or evening workout?
Morning for sure. 4:55.
All right. It's specific. I like it.
A minute.
Running or walking?
Running.
Lifting or body weight?
Lifting.
Indoor or outdoor?
Ooh, outdoor for sure.
Juice or smoothie?
Smoothie.
Coffee or matcha?
Coffee.
Salad or bowl?
Salad.
Pizza or pasta?
Pizza.
Tacos or quesadilla?
Tacos.
An early riser or night owl?
Well, here is my problem is that I'm an early riser, but I also don't go to bed early enough to be an early riser. It's a problem. I'm trying to work on it, but it's hard because this is not rapid fire answering. You spend so much of your day. I only have such a finite amount of time at the end of the day to like do the things that I want to do and talk to my husband without kids interrupting. And so I try to stay up to do the things that I want to do, but then I also have to wake up early to get my workouts in because there's really no other time in my day for that either.
Yeah.
So during the week, I'm both a night owl and an early riser. On the weekends, I'm a night owl, no early riser.
Yeah.
Well, I mean, my kids don't really sleep in, but I don't wake up at 4:55.
Well, that's good. Need some sleep sometimes.
So my Aura Ring likes my weekends.
Yeah. It's like great sleep. And then during the week.
Great. Optimal range. My readiness score's great.
Oh, gosh. Well, thank you so much, Paige, for coming on today. It was so much fun to chat with you. I know you just like opened up so many people's eyes to different things, and everyone's going to want to go and see a pelvic floor PT now.
They should.
For people who want to follow along, because everyone should follow your social media. It's funny and informative. So for people who want to follow along, where can they find you? And if they're in South Carolina, if you're taking new clients or new patients, how could they work with you?
Yes. So Instagram is Empower Pelvic Wellness. It's a hoot. And then my website is empowerpelvicwellness.com, and there's a contact form at the bottom of that. I'm always taking new patients, so reach out. And my number is on my website. It's my cell phone number. You can call or text, shoot me an email. I'm pretty easy and flexible. So yeah, find me there.
Amazing. Well, thanks so much, Paige. It was so great chatting. Thank you so much for tuning in to this episode of the Health by Haven podcast. If you enjoyed today's episode, please be sure to give the show a 5-star rating and leave a review. It makes such a huge difference in reaching new people and spreading the joy of healthy living. I would also be so appreciative if you subscribe to the show in the listening app of your choice so you never miss an episode. Your support truly means the world to me. Have a happy, healthy day, and I'll talk to you again soon.